Hello guys, welcome to Healthy Us. Today we will be talking about lung cancer and how to survive it. Lung cancer is the leading cause of cancer deaths among men and women in the United States, according to the American Lung Association. Most Americans believe that lung cancer is uniquely caused by smoking, and in turn they place blame on the person with lung cancer. In general, people are not as sympathetic to lung cancer patients as they are to people with other types of cancer. Though 90% of cases of lung cancer are attributed to smoking, you don't have to smoke tobacco to develop this potentially deadly disease. Living through the diagnosis and treatment of lung cancer has both physical and emotional effects. Living through a cancer diagnosis, whatever type it may be, is not easy. It is not as if we live, expecting to be diagnosed of cancer the next time we fall sick. Living through cancer is an unexpected journey, it is a fight, you are constantly making efforts to balance your body, mind and spirit. It is no different with lung cancer, whether you got it because of smoking or not. The pain is still the same. What do I do now? If you or someone you love has just been diagnosed with lung cancer, that's one of the first questions you will ask. It is important to get on the right track right away, seeing the right team, having the right tests, and getting the right treatment right from the start is very critical. The following are steps on how to survive lung cancer. 1. Invest in sophisticated diagnostics before diagnosis. If you smoke, were a long-term smoker, or are in an occupation that exposes you to carcinogenic toxins, I suggest getting a computed tomography (CT) scan, often called a CAT scan, of the chest once a year. CTs detect tumors far earlier than a chest X-ray. Early detection of small tumors dramatically enhances your survival chances. Also, be watchful for early symptoms like coughing up blood. 2. Choose a good doctor. It is best to consult with specialists who diagnose and treat a high volume of patients with lung cancer. Good physicians show kindness, consideration, and compassion toward those in their care. These characteristics are very essential. Seeking a second opinions at any point is also highly recommended to ensure optimal care for lung cancer. 3. Make sure to get the right tests. Every case of lung cancer is different. The right tests can help speed you to a specific diagnosis and a more accurate treatment approach. It is important to have biomarker testing of your cancer and all other appropriate tests as early as possible to help determine your best treatment options. 4. Learn about your disease. You need to know about type, stage, statistics, radiation, diagnostics, chemotherapy, side effects, surgical options, and so much more. Your chances of survival are improved if you are informed enough to ask highly perceptive questions each time you visit your doctor. Read everything you can find on the disease, read medical journals, government reports, research papers, and studies. Make notes about things you do not understand and ask questions at each oncology consultation. 5. Acquire a sanguine attitude very quickly. Cancer is a disease of death. Lung cancer kills more than all other cancers. Your attitude toward treatment is, I believe, essential to survival. When you acquire a sanguine attitude, your treatment team will notice your optimism. They will enjoy interacting with you, they will care about you. Also, find cancer support groups and join one. Most people who treat you have no idea how you are feeling. But survivors in cancer support groups understand, they know how you feel, you will fit right in. 6. Any port in a storm. There is no such thing as a little stick. During procedures and treatment, almost everyone will attempt to gain access to your veins with an intravenous device of some type. All such intrusions are uncomfortable, and unless the practitioner is good and lucky, he or she will miss more often than not. If your treatment involves intravenously administered chemotherapy, you likely will get stuck at least once a week. A good way to avoid discomfort and frustration is to ask for a port. Installation involves simple, low-risk surgery. Once in place, you need to keep the area clean and exercise precautions when bathing, but access to your veins is no longer a storm but a port in a storm. 7. Do not believe the miracle cure. The consequences of a lung cancer diagnosis are frightening. For most, it will be your first serious encounter with the prospect of death. When you type lung cancer into Google, you will be bombarded by advertisements that promise miracle cures at considerable expenses. There is no such thing as a miracle cure. Before you invest precious time investigating one of these too good to be true remedies, always discuss it with your physician first. Oncology is a medical science. Procedures, drugs, and protocols are tested using scientific methods that are published and reviewed by peers and regulating organizations. When science-based breakthroughs are discovered, they are broadcast very quickly throughout the practitioner community. 8. Don't try to tough it out. A lot of people, men especially, believe that they can handle almost anything. Cancer has proven to be anything that no man can handle. You may suffer a long time trying to tough it out before you admit that you are depressed, but the earlier you admit, the better for you. Admit you are depressed and accept help. Always wear warm clothing to diagnostic and infusion sessions. Some areas where these take place are kept very cold. Many treatment centers have volunteers. Engage one in a conversation. Many are survivors or caregivers and have a wealth of helpful information. I also suggest, if you can, always have someone with you for your consultations. Tea will be great. Because there are days you will be so frightened to ask questions about results or next steps, and you certainly won't remember anything that was said that day. 9. Become a calendar maniac. If you have a smartphone with a calendar application, become an expert in its use. If not, keep a paper cancer calendar to record information. Your life after diagnosis will likely become filled with scheduled appointments, and given the nature of the disease and intensity of the battle, these are appointments you do not want to miss. Plus, you have a life to live, and the calendar will help you avoid conflicts between your cancer treatment schedule and your life events schedule. 10. Choose to live. Cancer is a disease of life or death. I believe if you choose treatment, you are choosing life. And if you choose to live, do something with the life you are given. The something will be different for each of us, but doing whatever you enjoy or find fulfilling is so important. If you enjoyed an activity before diagnosis, do it afterward. Look at yourself in the mirror every morning. If you don't see an expiration date stamped on your forehead, then enjoy the day and look forward to the next. Oh, by the way, your hair will grow back. Baldness is a beautiful badge of courage. Stay the course. Keep the fight. Thank you for watching this video. If you haven't subscribed to our channel yet, hit the subscribe button below, and be the first to watch our next video.